Hello, guys. Welcome back to another episode of my clinical experiences. And in today's series, guys, we'll be covering a case of migraine, okay, and the homeopathic approach towards it. So it happened so that recently, in the past few days, I nearly saw about 3 to 4 cases. Four cases of migraine. So the medicine part of it, we'll be covering it in some another video because I want these videos to be very short. So initially I decided that I'll start with the medicine and the homeopathic approach, but since the videos were becoming too long and the views, the people were not even viewing it so much, so I decided let us stick to our basic homeopathic knowledge. So if at all you find a case or you get a case of migraine, hope this video helps you a lot, right? So it happened so that the patient came in to the OPD and said that, sir, I have this left sided pain. So we also have to keep in mind that generally migraines are either one sided, extending from the occiput to the eye orbit, or it can be shifting left, right, both, or sometimes the severe attacks can come in both the sides, right? So this was just a short medicinal aspect of it. But guys, what we need to remember here is that there are many homeopathic remedies. So if you all see the rubrics head pain, this nearly covers about 200 or plus medicines. But specifically, when I had this approach, so let me just make the pages for you all. So the patient came in and I took the totality of the whole symptoms and made a totality, and on that the left sided pain, left sided particular migraine headache, I gave the patient spigelia 200, okay. And again, I have this thing of whenever I prescribe something, I try to recollect and go to the people who have some good source of knowledge. So it happens so that one of my very good friends, um, of course I do not have that hang of visiting them personally because they stay quite far away from here. So I am in Mumbai and my friend is in Punjab right now, and she assisted a doctor and still assists a doctor who nearly sees about 200 to 300 patients per day. And the specialty of that doctor is that they use specifically borics knowledge and materia medica. So they solely practice on boric. So I mean, my friend was very kind enough to share me these clinical hints and clinical tips very selflessly and without any, I just have to ask her कि दी इसमें आप क्या देते हो. So I usually get my clinical cases confirmed from her that whether I'm going on right case, on the right direction or not, just to get a insight, right? Because you need to have good seniors. Since it is my shortcoming that I cannot ask help from my very extremely close people because I don't know, I just can't help ask um, advice or help from them. Like you all know that like I've been got the opportunity to sit with the best of the best people in homeopathy, but still I always get little anxious or little, that jittery feeling before asking something. Although sometimes I do ask, but most of the times I don't ask. So few of my other friends who are doing extremely well in their practice, I keep, troubling them. So I asked कि दी आप लोग माइग्रेन में क्या यूज़ करते हो जनरली, बिकॉज दे प्रैक्टिस वेरी स्पेसिफिक, राइट? काफ़ी स्पेसिफिक में वो यूज़ करते हैं एंड प्रैक्टिस करते हैं. तो लाइक आई सेड दैट इन द लेफ्ट साइडेड माइग्रेन पेन आई had already prescribed the patient spigelia, and I asked doctor also that what all you use. So she said that in the case of right sided migraine, they use Sancan, okay, and in the left sided migraine they use spigelia. Sorry, please pardon my bad handwriting. Spigelia. And when the pain is accompanied only in the left eye and very excruciating, we can think of the remedy onosmodium, okay. So these three medicines are like one of the top three favorite remedies which are generally come up when we take the whole totality of migraines. And now let us just quickly go through Borix Materia Medica and just read the head section about for you all, so that you all can at least remember these points from these remedies. Okay, so first we move on to Sancan, Sanguinaria canadensis, and let us check the Borix Materia Medica. Okay, so we go on to the Borix Materia Medica of Sancan, and I'll be writing the parts, important pointers here for you all, right? So head may, it is given that it is worse on the right side. Okay, right sided worse pain. Sun headache, generally we know that one of the most common aggravating factor in migraines is sun, and when we take this as the only thing, then natramur, glonoine are the important remedies that come in. But since we are now talking very specifically on right and left side, let us move ahead with the next pointer, that periodical sick headaches pain begins in occiput, spreads upwards and settles over eyes, especially right eyes. Veins and temples are distended. So this is a classical picture of a migraine headache, wherein it starts from occiput, travels through the whole head, and then ends up near the eye socket. And especially when it's in the right side, it is Sankan. Pains are better by lying down and sleep. Headaches return at climacteric every 7 days. Sulfur and savadilla are the important remedies here. Pain in small spot over upper left parietal bone, burning in eyes, pain in the back of head like flash of lightning. Okay, and in face it is covered that flush neuralgia, pain extends in all directions and from upper jaw, redness and burning of cheeks, hectic flush. So now we cover Sankan from Dr. Fatak as well, since you all know that the two books which I regularly use is Dr. Borik's Materia Medica and Dr. Fatak's Materia Medica. So Dr. Fatak writes in his first letter, I mean the first sentence of the remedy, commonly known as blood root, is right-sided remedy affecting the head, liver in capital, chest and deltoid. It produces vasomotor disturbances as seen in circumscribed redness of cheeks, abdomen and tongue, congestion of blood to head, chest, abdomen, etc. Burning heat and ebul- ebullitions, ebullitions are the important keynotes. And we move on to the head. So Dr. Fatak mentions that pain over the right eye. So we have pain over the right eye, which is ascending from occiput to over the right eye. So it travels back, right? Travels down. Hemicrania, which is again a typical presentation of migraine, increases and decreases with the sun. Distension of veins in the temples, pain in the occiput like a flash of lightning, vertigo worse looking up and moving head rapidly, headache if he goes without food, headache better by sleep, vomiting and passing of copious flow of urine. Okay guys, so this was the remedy Sankan. Now we move on to the remedy for the left sided, generally left sided pain. And when we cover and study the left sidedness of pains, so we get the remedy which is very important and which was like told to me by my doctor, Spigelia. So we move on to the Borix Materia Medica of Spigelia, right guys? We need to keep the video short, under 10 minutes, so like let's move on with some good speed. So yeah, in Spigelia, the pain is from beneath frontal eminence and temples, extending to eyes. Okay, the same like onosmodium, but this is left sided. Semilateral involving left eye, pain are violent, throbbing, worse making a false step. So violent and throbbing are again some characteristic symptoms. I mean some general symptoms, common symptoms of a migraine headache, right? But these symptoms can clinically verify migraine. Okay, so semilateral involving left eye, pain, violent throbbing, worse making a false step, pain as if a band around head like carbolic acid, cactus or gels is given, and vertigo is hearing. Vertigo hearing is exalted. So the hearing is exalted and there is also a lot of vertigo. In eyes, fields too large, pressive pain on turning them. Pupils are dilated. there is a lot of photophobia, rheumatic ophthalmia, severe pain in and around the eyes extending deep into socket. So this, guys, again is a very specific remedy for pain in the left eye, wherein there is severe pain in and around eyes extending deep into socket. There is ciliary neuralgia, a true neuritis. Now we move on to what Dr. Fatak has to mention about the remedy spigelia. So Dr. Fatak in his first generalities mentioned that it is known as pink root, markedly affects the heart, nerves, trifacial, heart, eyes, teeth, fibrous tissue, and left side. So left side is very well marked in spigelia. So we need to remember left sided. Okay. The patient is worse by touch motion and better by lying on right side with head high and inspiring. Head pain from legs left occiput to over left eye. Okay. So this in Sankan we had left right occiput to right eye. In spigelia, we have pain from left occiput to left eye. Again, a classical presentation of migraine. Then the patient is worse stooping, making a false step, opening mouth, vertigo, the feet as if higher than head, worse looking down, must look straight ahead, worse standing, walking. There is also a supraorbital neuralgia and the head feels too large. Okay, guys, and lastly, we cover the remedy onosmodium because it's again a very important remedy for migraine. Okay, so onosmodium from Borix materia medica, the head part. There's a lot of loss of memory, nose feels dry, confused, dull, heavy, dizzy, pressing upward in occiput. So there is dull, heavy, dizzy, pressing pain upward in the occiput. The word here clearly written is occipitofrontal pain in morning on waking, chiefly the left side. Okay, so it's again a left sided remedy, and there is pain in the temples and as well as the mastoid. Okay, guys, so I think so with this we have covered three important remedies for migraine. If at all someday your OPD is like very busy or you get a lot of patient flow like our senior doctors are having right now, you can remember this three tips which I got from my senior doctor, whom I respect a lot. But like since she's an introvert, she would not like the name to be revealed, right? So I'll keep it that way. But like I said, that she doesn't have any, she doesn't have any issues with the knowledge being shared, and they all are very happy-go-lucky people, and they have always helped me. The Didi has always helped me, and she's always guided me like whenever I've got stuck. So, like I said, that this generally in this clinical experience of series we are using references of repertory as well, but in this video I wanted to make sure that you can also sometimes take the approach and the clinical experience of other doctors to help in your practice. And if at all you are blessed with good people around you, you will always bloom better, right? So I'll try my best to help you all out. Till then, goodbye, take care, thank you so much, and please do like, share, and subscribe the videos. It will motivate me to make more and more such videos for you all. Do keep supporting us. Thank you so much. Take care. God bless.